President Joe Biden's administration threw the director of the Center for Disease Control and Prevention, CDC, under the bus after she suggested that teachers could return to classrooms before being vaccinated. There is increasing data to suggest that schools can safely reopen and that safe reopening does not suggest that teachers need to be vaccinated in order to reopen safely, CDC Director Rochelle Walensky said at a February 3 press briefing. Vaccination of teachers is not a prerequisite for the safe reopening. White House Press Secretary Jen Psaki to Walensky's statements later that same day, telling reporters that the CDC director's comments were not official guidance and that she was speaking in her personal capacity. The president, let me be crystal clear, wants schools to open, Psaki said during the press briefing. He wants them to stay open. And he wants to do that safely. And he wants health and medical experts to be the guides for how we should do exactly. Dr. Walensky spoke to this in her personal capacity, Psaki continued. Obviously, she's the head of the CDC, but we're going to wait for the final guidance to come out so we can use that as a guide for schools around. Jennifer Nuzzo, a senior scholar at the Johns Hopkins Center for Health Security, told that Psaki's statement was alarming. I don't know if there is a split, but it was alarming last week when the White House implied that the CDC director was speaking in her personal capacity, because when it comes to safety and what is required to reduce or mitigate the spread, that's a CDC question that should only be answered by the CDC. Nuzzo, I found it worrisome because we have to affirm and assert CDC's expertise here, she added. It's a particularly tricky issue and it's important to be clear that there is no political interference and that there is no agency more qualified to weigh in on this than the CDC. President Biden has said that school reopenings would be a priority for his administration, promising that students would return to in-person learning within the first 100 days of his presidency. Psaki during a Tuesday press briefing that the administration's goal was to have most schools open at least one day a week by Biden's 100. Despite scientific evidence showing that there is little risk to reopening schools for in-person learning, teachers' unions have for schools to remain closed. The unions argue that it is unsafe for teachers to return to the classroom without first getting the coronavirus vaccine, a statement that Walensky directly. Biden appears to be on the same page as the teachers' unions despite promising to side with science. While he was running for president, then candidate Biden former President Donald Trump after his travel bans were announced, accusing Trump of hysterical xenophobia and fear-mongering and not listening. During it with ABC, Biden said that he would listen to the scientists if they said it was necessary to shut the country down. And when he introduced his scientific advisors, Biden promised that they would fight the pandemic with science and truth. This is a team that is going to help restore your faith in America's place in the frontier of science and discovery, Biden said. According to the science behind climate change is not a hoax. The science behind the virus is not. Science is discovery. It's not fiction, he added. It's also about hope. The CDC told that Walensky's comments were based on the CDC director's review of the science. Joseph Allen, a professor at Harvard, said in a tweet on February 5 that undermining the new CDC director 3 weeks in is not a good scientific evidence that in-school transmission of the coronavirus is rare, and reopening is safe when certain precautions are taken. In a published in the Journal of the American Medical Association, 3 CDC researchers concluded that there has been little evidence that schools have contributed meaningfully to increased community transmission, and urged schools to reopen with proper. Another study found that schools in rural Wisconsin that were taking precautions such as mask wearing had lower rates of transmission than in the community. Still, reopening has dragged on slowly at the expense of students. The gap between students from low-income and high-income families has due to virtual learning, which has left some families with insufficient resources for their children's education. The impact of virtual learning on children's mental health has been devastating. Families how their children have fallen into depression, lost their sense of drive, and grown increasingly fatigued from staring at a computer screen all day without any social contact. The situation became so dire that schools in Clark County, Nevada, the 5th largest school district in the country, began students' devices for mental health warning signs after the number of suicides